Good evening, I'm Ces Oreña-Drilon.
I'm Pauline Verzosa.
And I'm Shawn Yao.
The big stories tonight. Many are wondering now, is the government's promise of a bold cabinet revamp just a case of much ado about nothing? Most of President Marcos's core cabinet is retained, but his executive secretary says there will still be blood.
And the health department sounds the alarm over the surge of HIV cases in the Philippines. The DOH now says this calls for the declaration of a national public health emergency.
And House lawmakers are growing more worried by the day over the holdup in the impeachment trial of Vice President Sara Duterte. They're accusing the Senate President of putting the whole process in limbo to protect the VP.
Well, if you are asking for blood, there will still be blood.
Executive Secretary Lucas Bersamin once again faced the media to announce the next cut from the cabinet revamp. But it's still not the reset as sweeping and as bold as the Marcos administration promised. President Bongbong Marcos declined the courtesy resignations of most of his cabinet. But Bersamin says the performance review of officials is still ongoing and that those found underperforming will have to go soon.
There were only two notable announcements from Bersamin today. First, Francis Lim will be the new chairman of the SEC, or Securities and Exchange Commission, replacing Emilio Aquino, whose term ends on June 5. Then there is Secretary Enrique Manalo, who will be staying on as Foreign Affairs Secretary, at least for now. Manalo was supposed to be the country's next permanent representative to the United Nations in New York. But he has to wait until August 1st to assume the post, or until he gets confirmed first by the Commission on Appointments as envoy.
So far, the much-touted great cabinet revamp of the administration has resulted in a few boot-outs and some musical chairs. Environment Secretary Tony Yulo Loizaga has been replaced by Energy Secretary Rafael Lotilla. Sharon Garin is current officer in charge of the DOE. Then there's Human Settlements and Urban Development Secretary Jose Rizalino Acuzar, replaced by Ramon Aliling. Acuzar has since been appointed Presidential Advisor for Pasig River Development. A changing of the guards as well at the Office of the Solicitor General. Menardo Guevara is out and UP Law Dean Darlene Berberabe is in. President Marcos also accepted the courtesy resignation of Popoy de Vera as chairperson of the Commission on Higher Education, and he was replaced by CHED Commissioner Shirley Agrupis.
For observers, this cabinet revamp is underwhelming in that it has been done in installments. But Executive Secretary Bersamin says there will still be blood in the coming days and weeks. We will circle back to this story later on in the program. And in the meantime, one of those retained in the Marcos cabinet is Health Secretary Ted Herbosa, who is now calling on Malacanang to declare a national public health emergency. That's amid a surge in HIV cases nationwide. Here's a story from mobile journalist Yeda Pascual.
Dwin was only 9 years old when he contracted human immunodeficiency virus, or HIV, after falling prey to sexual abuse. The reality of his health condition only hit him when he was already 14. Now 26 years old, Dwin is on continuous medication.
As I grew up, inuunti-unti nila na matanggap ko yung story na meron ako and matanggap ko yung story about HIV. And ayun po, luckily I am living and breathing with my normal life.
Dwin is just one of more than 150,000 persons living with HIV in the Philippines. There are now treatments available. But what's alarming, according to the Department of Health, is the sudden 500% rise in cases, especially among the youth. Per DOH data, ages of new patients this year range between 15 and 25, while most patients are within 25 to 34 years of age. The youngest by far is a 12-year-old from Palawan, who got the disease from unwarranted, unprotected sex.
It is alarming. No? Any sexual contact with a minor, kahit anong pakikipagtalik sa bata, ay rape.
DOH also notes more than 5,000 of new HIV cases were already recorded during the first 3 months of the year. That's much higher compared to numbers from the same period in 2024 of more than 3,000. Now at least 54 new HIV infections are recorded every day. At the moment, the Philippines has the highest recorded incidence of the disease in the whole Western Pacific region. That's why the DOH has this recommendation to President Bongbong Marcos. Declare a national public health emergency for HIV. This is to enhance HIV testing, prevention, and treatment. Because if it can't be done now, the DOH estimates the total number of people living with HIV in the country to balloon to more than 400,000 sooner than later.
Hindi ibig sabihin lockdown, hindi ibig sabihin pandemic. Pag dineclare mo kasi as a public health emergency, nagiging concerted yung effort, nagiging sama-sama at nagfo-forward siya. Kasi ang bilis ng panik eh.
The Health Department is also urging the public to remember the ABCDE of preventing HIV. A for abstinence, B for being faithful, C for condom use, D for avoiding drugs, and E for educating oneself about HIV. Mobile journalist Yeda Pascual, we are One News.
And now here's what the Department of Health said is a lesser threat than HIV, but is definitely still a concern: Mpox. Confirmed cases in Baguio City, for one, went up to 7. According to Mayor Benjamin Magalong, all these patients have already recovered, but they are back to contact tracing. That's after a suspected patient in La Trinidad, Benguet reported having lived and worked in the country's summer capital. Over in Cebu City, all 3 confirmed cases have also recovered, but there are still 5 being monitored in hospitals. The local government has activated an interagency task force to focus on combating the spread of the virus in the area.
And what about Mpox vaccines? Well, there are inoculations already available, but the Department of Health says there's none yet for the Philippines because supplies are limited to African countries most affected by the virus. Health spokesperson Dr. Albert Domingo says that for now, we can only hope that the Philippines will have a louder voice on the matter of lacking Mpox vaccinations. That's with Health Secretary Ted Herbosa at the helm of the 78th World Health Assembly, the world's top health decision-making body.
And speaking of the health chief, he now joins us on the big story. Welcome to the program, DOH Secretary Ted Herbosa.
Good evening, Ces. Good evening, Pauline, and good evening, Shawn, and to all the televiewers tonight.
Before we talk about, well, AIDS, HIV, AIDS, and Mpox, when did you know that you were being retained by the President in his cabinet?
I just knew it around 5 p.m. during the live telecast of our Executive Secretary.
Oh, you weren't told directly?
No, I wasn't told directly. I was in the Senate the whole day. There was a committee on hearing at the Senate, and so I was present at the Senate the whole day, from morning to afternoon.
One of the things the Executive Secretary said was there was this air of uncertainty, and that's why he had to make that announcement. Did you feel that? Did you feel like, you know,
yes, of course.
No?
That's right, Ces. No? In fact, all of us, when we were appointed, we knew we served at the pleasure of the President. Even now that our resignations have been rejected, we still serve at the pleasure of the President and can be fired anytime. So what I said when the rejection of the resignation came is that I'll work even harder to make sure that the goals of this President, who is very health-focused, he really wants to fix the health system of the Philippines. I will doubly work harder so that we can deliver the goals of our President.
Did you feel that there were certain sectors who wanted someone else in your post, pushing for another appointee? Was there jockeying?
I was reading negative news articles about me, but I also read a lot of support from the medical community, the professional societies, the other health workers. So it was a balanced thing, you know. So you're unsure. You're unsure what would happen. Yes.
You had it from both sides. Now let's go to the request that you want. Have you made it formal to the President that a national health emergency be declared?
Yes, in behalf of the Philippine National AIDS Council, so we have a Philippine National AIDS Council that's a collaboration of government agencies and civil society, nonprofit organizations that sit in a council, and I chair that. And we've been looking at the data since months back, even until October last year. And we had seen the continued rise of cases. It was like in 2010, it was like 6 new cases a day. And then you heard your news clip,
Yeah.
it's about 56 new cases a day. So that's a total of about 26,000 new cases last year. When in fact, the people living with HIV in the country is only about 140,000. So that's a big jump. It's about a 500% increase. And many sectors in the international community are actually watching us and what we will do. So it's really very important that we stop this very fast transmission or increase of new cases. Otherwise, in about 5 more years, by 2030, we will have half a million people living with HIV in the Philippines. That's a lot. That's going to be a lot.
Do you expect the president to declare a health emergency?
I think I will get the support of the president because it's the president that orders the other agencies of government. You see, as Secretary of Health, I cannot order DepEd to increase campaign against HIV or education of our children or HIV as a disease, and DSWD also, labor. So there are other agencies that can help me stave the rising cases of HIV in the country.
Okay, one of the figures, Secretary, that you guys pointed out was that a child as young as 12 years old was already infected, right? And the biggest rise is in this age group of 15 to 25, and that's kind of alarming. Talk us through how our data has changed. I mean, we have had this HIV problem as far back as a time of President GMA pa, no? Nung kumakalat siya sa mga BPO. Tell us how that has evolved into this younger subset of our demographic.
So my theory, Shawn, is that we have a generation of kids that never saw the scourge of AIDS when it had no treatment. Because today, as of today, there is treatment as long as you're getting your ARV. You even have a patient that you showed. He's doing fine as long as he's taking his medications. So this is how the situation is today. You don't see people, dying of AIDS on the streets like it was when I was a young doctor. It was our COVID-19. That was the scare of that pandemic. But this generation of kids, the 15 years old, they never saw this. So I think that's why there's so much unprotected sex. Remember this Mpox? We discovered this increase when the Mpox started going around because we discovered spas and other habits, group sex and anonymous sex was happening in our younger population. So I think all these factors put together has led to this increase. So we need to fight it. We need to educate our young people on the use of condoms, abstinence, single partners rather than anonymous partners, because we saw this with COVID, with monkeypox. We couldn't trace their contacts because they couldn't tell us who their sexual contacts were because they're anonymous.
But why is it unique to the Philippines? You don't see this happening to other countries?
The Philippines has been for a long time very low in the map of HIV. In fact, I think Thailand has more. They have millions living with HIV. They were the hotbed of HIV. Over that time, opposite tayo. We always had low numbers. We are less than 1% of the population with HIV. But this recent few years, it suddenly went on a jump. And I had a talk with Dr. Edsel Salvania, who's an HIV expert, infectious disease. And he's telling me there might be a mutation that we're looking at here with a faster spread and contagion. So it's really very important that we still practice. Well, it doesn't change anything. The precautions are the same. You do condom use, single partners, abstinence, all these things, and then testing. There's still apparently a stigma in the Philippines. So kids are afraid to get tested. And if they get tested and they're positive, they disappear. They get scared. They don't want to tell their parents. They don't want to get treatment. And then they come back to us with advanced HIV. So we really need to declare kind of a public health emergency so that all hands on deck of the government, the civil society can help me really stave this problem, really top up and even lower the numbers immediately.
But Secretary, how accessible and affordable is treatment for HIV? Is it true that the Department of Health is offering free treatment for those? Yeah.
Yes, Pauline, you can only get the antiretrovirals from government. That's what's unique about HIV. It's only the government, and it is paid for by PhilHealth. So you get them from treatment hubs. You cannot buy the treatment in the regular drugstore, even if you had a prescription, because it is provided. And the reason for that is we want to really make sure that people are receiving their medications and do not die from complications of HIV. Our problem is that some people disappear after they get tested. I think because they're too young, itong 15 to 25, they have to get parental consent to get treatment. So imagine 95% of my cases are men having sex with men.
Do you
Your
think that
son will tell the father, I got HIV and I got it from having sex with other boys. I think they get scared and they don't end up having treatment. So we need to change some of our consent laws. Maybe the doctors can start to provide the treatment if the child wants treatment.
How hard would that be to change the consent laws? I mean, that might be a little tricky, Secretary. Correct me if I'm wrong.
because they are minors?
Yeah.
That's tricky if there is no public health emergency. And that's one of the reasons why I think a public health emergency declaration can hasten this. Because remember, when we had COVID, the vaccine was approved in record time. The money to buy the vaccine was approved in record time. So there are things we can do in a state of public health emergency that would have gone very long.
Is the treatment expensive?
Yes, it's quite expensive. And there's even new treatment available in the horizon.
But prices
That's
have
just
come down.
injectable every 6 months. Because right now you drink so many tablets when you're taking the ARV, and we give a 1-month supply when they go to the treatment hub. They do a lot of tests to make sure your viral load is already untransmittable.
Secretary, sorry to but there are new treatments available, and I remember nung tinanggal yung USAID funding, this is what we were talking about, because a lot of these mga HIV patients rely on NGOs. Sometimes they're afraid to go to health centers, so they go to these NGOs and they get the more modern kind of treatment.
Pero wala na yan.
Wala na ba yun? And can you
not
guys
here.
offer it? Yeah.
Oh, let me correct you.
Okay.
The U.S. pulled out USAID. Most of the money that was pulled out was TB money. So we still have this from Global Fund and from PEPFAR, the President's Emergency Response Plan against AIDS. So this is still available. We have yearly $7 million, and the experts are also still here. They've even created an office here. In fact, last March, because of our very high HIV rates, PEPFAR held their annual conference in Manila because of this rising cases. This was last March of this year. So very important that we continue to actually support the education of kids. So DepEd, I've talked to Secretary Sani Angara of this problem because these 15 years old are still in high school. And then we also have to talk to DSWD, also DOLE, because they also have measures in the workplace. Because some young people in the workplace, like the BPO that you mentioned, was identified before as
This is
cases
similar,
where there's transmission.
Secretary, to Mpox. The transmission is similar.
Yes, intimate and
So-
sexual contact is the transmission.
All right.
Not airborne. So you don't get HIV just by talking to someone
So
with HIV
if we can
or kissing.
shift to
It has to be sexual
Mpox,
contact.
we can shift to Mpox
Yes.
because again, in our neighbors, it's COVID. That's the worry. But in our case, it's Mpox.
No, Mpox is actually lower than last year. So it's not true that there is an increasing case of Mpox.
All right.
What is true is that our LGUs are now reporting every time they have Mpox cases in their area. That's actually very good to inform people about the disease. But our number of cases is lower from last year. So there is no increase in Mpox, but we do have Mpox. And the Mpox we have is clade 2. This is the self-limiting one. In fact, most of those reported have already become better or have been released from isolation. The Mpox that is dangerous is clade 1b in Africa. And that's why the vaccines are in Africa in your report, because that's where the people are dying from MPOX.
So that
Here,
go
there
ahead,
are
Secretary.
deaths, but they were deaths related to people with HIV and MPOX. So they actually died of AIDS, not of the MPOX. The MPOX was just one of the diseases they got when their HIV got advanced.
So that's what's concerning here, Secretary. Ano? Walang available na vaccine for MPOX here in the Philippines. So is there a way that we can climb up the priority list? And by the way, congratulations on being appointed as the President of the World Health Association. Makakatulong po ba yon, Secretary, sa pag-lobby po natin to ask for more supplies for MPOX vaccines?
Pauline, because the clade we have, the type of MPOX we have is self-limiting and mild. It's not the one that you'd want to have a vaccination program. What has happened is that MPOX became my tracer disease for HIV. Why? Because the people, the key populations, consult a dermatologist or a doctor when all these ugly lesions come out of their face or arms. Then we also test them for HIV. 30% of our patients that had MPOX had HIV when tested for it. So it's become my tracer disease. And it's also become that educated me what are the sex practices of this population. Na-discover namin na may mga spa for men, merong online sex na anonymous, and then they just meet up in one place and they don't even know each other. Because we were trying to do contact tracing for the MPOX. So it's this behavior change that also needs to be corrected.
So,
what I call risky behavior.
Okay,
This
again,
needs to also be corrected.
it's 15 to 20 and mostly
Fine, yes.
mostly men.
Yeah, 95%. The scary part says is that some of these men or boys may also be bisexual and may also have sex with women. So if I don't control this, it can spill over to women as well.
Secretary Herbosa, in the interest of trying to raise awareness with the public, if you are young and if you're watching right now and you're thinking you want to get yourself checked, but you're also scared of your mom and your dad, what are the available options for someone in that age group?
Okay, number one, there is a self-test kit that's now been approved by the FDA, so you can buy it in the drugstore. It's a self-test kit. The other thing is you can go to the treatment hub. If you're 16 and above, you don't need parental consent to be tested. Our law allows that. But you need parental consent once it's positive and you need treatment because it's the PhilHealth of your parents we will use. And of course, even if you don't get consent, once you start treatment, they will see you're going to a treatment hub every month and getting the antiretroviral. So, malalaman din yan.
All right. If we can ask you also, Secretary, since metaning sa inyong posisyon, diba? You said you're always serving at the pleasure of, you are serving at the pleasure of the President, and there's a continuous, according to the Executive Secretary, performance review. Saan nyo pag-iigtingin ang inyong serbisyo?
So apparently ang utos sa akin ng President is really to make the services of government closer to the people. So yung pila sa mga hospitals, I'm trying to contain. Nag-umpisa ako ng
Sinabi
patient
niya yan
point
sa kanyang
system.
podcast #1.
Correct. Correct. So inutos niya sa akin to when he appointed me to make services closer to the people, igsian yung mga pila to get services. Like this one, HIV services. We have treatment hubs all over the country, making it sure that our kids can get tested if they want to be tested. Our kids can get HIV treatment if they get treatment. And then yung congestion sa hospitals, medyo na-solve ko with the Bukas, which is a bagong urgent care and ambulatory centers. I brought ambulatory centers closer to the community and other solutions. I'm trying to increase also PhilHealth reimbursements for dialysis, for heart attack. That way, kahit private ka mapunta, the PhilHealth can cover for most of your expenses. So we're trying to solve it at different grounds. Our health system is broken because we discovered this during COVID. Hirap na hirap tayo. So now I'm trying to strengthen our health system so that every Filipino can continue to work and be productive members of society. If Filipinos are healthy and productive, our economy will also prosper kasi they will become productive and earn money.
Secretary, now that you're pushing for this state of emergency, because of the HIV rise or cases rise, how amenable do you think the president will be about this? And also, how will this be affecting the 2026 budget? Are you going to be batting for a certain amount just to combat this specific problem of HIV with the youth?
Well, number one, I think the president will be supportive of this project. Of course, all I want is help from the other government agencies to combat this. And sometimes it's just education, additional education. That means modules for DepEd, which we will also be willing to make so that the teachers can teach the children about the scourge of HIV. The SWD, DOLE can cut up measures so that testing can be available. And then, yes, we will have a little increase in our budget for HIV. If we really want it to go down, we have to really increase some of our budget for health promotion, testing, and treatment for these patients.
Secretary, recently we also had Dr. De Grano of P Happy, and he was talking about how medical services the costs of medical services are rising by 10 to 15%. How does the health
Correct.
department plan to cushion the impact of that?
Yeah, so after the announcement of Dr. De Grano, I tried to talk to our private sector people, and in fact, they declared to me the cost of medical supplies and medicines have gone up in the global market by as much as 30%. So this supply chain and these trade wars have actually increased our cost of medicines, but they're still absorbing it. So a 5% increase or 10% increase in the cost, they're still absorbing it. What I said is maybe we should start doing some kind of bundled services like your Happy Meal, so we can bundle services so we can lower the cost so it can become affordable. And our private hospitals were amenable to something like this, free checkups together with, bundle the maternal checkups together with the vaccines and the multivitamins. And then I'll increase the PhilHealth rates so that they can recover their cost. We have to make the healthcare sustainable.
We were surprised that you paid a big portion of the dues to the private hospitals in one go.
Yes, this is part of our reforms at PhilHealth. I also have a new president and CEO at PhilHealth who is a hospital director and is an orthopedic surgeon, so knows the clinical side. So we know that if PhilHealth doesn't reimburse the hospitals will loan money, will increase their prices, and it doesn't make healthcare more affordable. So the idea is that every Filipino has PhilHealth, we increase the cost, and we allow, even if they go to the private or the public, they will be able to address the copay. Kasi sa private, merong copay. Sa public, I'm planning to announce with the president, malibre ko na yung all the wards and all the semi-private in the DOH hospitals.
To be fair,
Kailan yan? Sa SONA?
I'm presenting it to the president. I have a computation, and if he's going to give me the extra funds, he can announce it because that's going to be his project.
But one thing that really caused also all these debts is yung mga guarantee na binibigay nyo sa mga politiko. Is there some way to avoid that and give the tulong diretso?
So
Galing
that's exactly my
DOH,
point.
hindi dumadaan sa mga kung sino-sino pumipirma na hihingan mo pa, 'di ba?
So kaya gusto namin malibre na yung consultation sa DOH hospital. Hindi ka na kailangan. If it's free, you don't need to go to a politician to broker for your healthcare.
So you're going to remove that?
We're kulang pa kasi ang funds, Ces. So we have to top up some of the funds or some things will have to still be built or built small naman, discounted. Expensive implants, expensive tests, hindi pa rin kaya ma-fund lahat. But slowly we're getting there. For all the poor.
So ganito ba ang gagawin ninyo? Parang yung 3+1 1 plus 3 ni Vince Dizon sa MRT, parang ganyan.
Siguro parang ganon. Or yung
family
what you get in the
package.
fast food, di ba? In the fast food, di ba? You get a bundle of things.
Biglang nagpapagalingan kayong mga nasa kabinete,
True. Ini-evaluate kami.
Dapat pala ganyan ang gawin. Takutin kayo.
Sec, very quickly lang, last question. Alam ko nagtaas na kayo ng case rate sa PhilHealth.
Yes.
But then nagtaas rin kasi yung mga ospital ng private hospitals, at least ng mga rates.
True.
Will you be reviewing again to make sure na, medyo pumatas naman yung coverage?
Well, ang request ko kasi sa private hospitals, you can go ahead and increase the rates for the single room and the suite room, yung sa mayayaman. Pero yung sa ward and the semi-private level, for our middle class, huwag niyo munang i-increase. Hayaan niyo munang humabol ako. Payag naman sila kasi I think willing sila to help the country really improve our health system.
All right. We thank you so much for your time, Secretary
Thank you so much.
Herbosa.
Thank you. Good evening.
Right, we're just going to take a quick break, but coming up, Senate President Ces Escudero claps back at lawmakers who accuse him of handling Duterte's impeachment trial with kid gloves. That story and more when we return. Keep it here on The Big Story.
You're watching The Big Story here on One News. It was described as a bold move when President Ferdinand Marcos Jr. called for the courtesy resignations of his entire cabinet. It was an effort to reset his administration. But in the third cut from the cabinet revamp today, it looks like most Marcos officials are keeping their jobs after all. Here's a report from Mobile Journal Julie Baisa.
President Ferdinand Marcos Jr. has decided to keep most of his cabinet secretaries after calling for their courtesy resignations last month. The chief executive's recalibration of his administration follows the results of the midterm elections. But on Tuesday, the third installment of the supposed reset, it looked like the revamp was not as sweeping as promised.
You know, this is not a purge. You must understand that. That's why we went to the courtesy resignation as the means for implementing this reorganization.
Among those that had their courtesy resignations declined are secretaries of the government's frontline agencies: Francisco Chu Laurel Jr. of the Department of Agriculture, Conrado Estrella III of the Department of Agrarian Reform, Sani Angara of DepEd, Francisco Benitez of TESDA, Bienvenido Lagasma of DOLE, Rex Gatchalian of DSWD, Teodoro Herbosa of the Department of Health, Hans Leo Cacdac of the Department of Migrant Workers, Renato Solidum Jr. of DOST, Cristina Frasco for Tourism, Henry Roel Aguda of DICT, Vince Dizon of the Department of Transportation, and Manuel Bonoan for DPWH. Also keeping their posts are Juan Ponce Enrile as Chief Presidential Legal Counsel, Elaine Masukat of the Presidential Management Staff, Romando Artes of the MMDA, and Leo Tereso Magno of the Mindanao Development Authority.
If you are asking for blood, there will still be blood. But, you know, we are still undertaking continuing performance evaluations even of those undersecretaries or those lower than the cabinet rank functionaries. I assure you that this is a very sweeping and thorough evaluation being made by the President.
Among the first wave of resignations to be declined were the President's economic team, which is the DTI, DOF, DBM, and NEDA, as well as the Cabinet Security Cluster composed of the DOJ, DND, and DILG. Meanwhile, Marcos accepted the courtesy resignations of Maynardo Sabili, Presidential Commission on the Urban Poor Chairman and Chief Executive Officer, Presidential Assistant for the Visayas Terence Calatrava, and Presidential Assistant on Muslim Affairs Almarin Tila. Bersamin said the President also terminated the Presidential Advisor on Special Concerns Menandro Espinelli. Mobile Journal Julie Baiza, We Are One News.
Meanwhile, Transportation Secretary Vince Dizon is the first post-cabinet revamp official to hurdle the Commission on Appointments. The CA Transportation Panel, led by Senator Grace Poe, approved Dizon's ad interim appointment as DOTR Chief. No member of the panel objected to Dizon's confirmation, which has been endorsed through the Senate plenary for approval. It was also during the hearing that Dizon confirmed he has been retained in the Marcos cabinet.
Baka mamaya, after 3.5 hours of deliberating here in the Commission on Appointments, biglang tatanggapin yung courtesy resignation nila. I'm sure si Sec Vince hindi, no? But it's also good probably to us if he was able to get a assurance or at least a go signal by the President or the Executive Secretary to come here, Madam Chair. Otherwise, sayang you get where we are coming from.
Yes, and just to answer the question directly, kahit na I'm a little embarrassed to do it, but I did get a call from the Executive Secretary that the President did not accept my courtesy.
Thank you.
Meantime, Department of Information and Communications Technology Secretary Henry Aguda and Presidential Communications Office Secretary Jay Ruiz were also slated to face the CA today, but their hearings were deferred due to lack of time.
Moving on to some House members already losing patience with the Senate for the delay in the start of Vice President Sara Duterte's impeachment trial. Members of the Makabayan bloc slammed Senate President Ces Escudero for moving the presentation of the articles of impeachment to June 11. ACT Teachers Representative Franz Castro asked Escudero if his move was in retaliation for the House passing the articles on the last session day before the elections.
Well, something fishy. At nakikita natin na paghahanda na ito doon sa mga gusto nilang mga position ba o sa 2028, etc. Kaya unahin nyo naman for the first time ang taong bayan at wag yung mga personal na mga interest nyo. So wag nang mag-deny si SP na talagang meron siyang pinoproteksyonan, meron siyang balakin sa mga susunod na mga panahon.
Senate President Escudero shot back by saying it is the House's fault that Duterte's trial is now on a standstill or may not even see the light of day.
Pwede bang irally ko rin sila ng 4 na buwan o hindi nila inaksyonan yung impeachment complaint kung sila mismo ay hindi nagmadali? Inupuan at pabanjing-banjing sa mahabang panahon. Sino naman sila para madaliin kami ngayon? At the right time, it will be put to a vote. Ano man ang pagpasya namin, hindi pwedeng itali ang kamay ng susunod na Kongreso. Sa yung susunod na Kongreso, ano man ang gawin namin, wala man kaming gawin. May kapangyarihan, pagpasahan yung parehong issue pa rin. So, depende sa mangyayari.
And joining us again on the big story to discuss all these political movements is political strategist Malu Tiquia. Good evening to you, Malu. Welcome to the big story again.
Hi, good evening, Ces. Good evening, Shawn and Pauline, and good evening to your televiewers.
Let's tackle the revamp that never was. What's your take on it?
Ces, yes, that is supposed to be a revamp, and by definition, a revamp doesn't only cover 2 secretaries or 3 secretaries. It tries to realign whatever happened during the May 2025 elections and an assessment of where the president is going to bring this country in the next 3 years. So right off, it took them almost 2 weeks to complete such a performance evaluation. The public has not been informed on the KPIs, the key performance indicators that were used, or the metrics that were used in order to say, oh, alis ka dyan, who's this, Solicitor General, o alis ka dyan, Secretary of Natural Resources, or alis ka dyan, DOE. If you look at the Administrative Code of 1987, there are 25 cabinet rank members of the official cabinet of the president. Today, we saw 22 who were, the courtesy resignation was not accepted. So lumalabas, ang talagang malaki lang siguro na mahalaga dyan is si Solgen. Because the reason why the Secretary of the NR was accepted was a sly reason of maraming travels abroad. Diba? Nothing to do with policy or job performance. It's just the travel. But if you look at the travels, most of those are in connection with climate change, in connection with SGD. Yung SGG, hindi naman tayo kayang mag-exist on our own. Yung climate change, talagang yan ang kabisado si Secretary Yulo. No? And then you have DOE, who was, he was asked to handle environment and natural resources. Energy is extractive.
Yes.
And DNR
parang
is...
turn around, no? Of perspective.
So kung titingnan mo, sino talaga ang pinunto? Mukhang ang pinunto lang naman is si Solgen.
Dahil pro-Duterte siya.
Yes, and di ba there was a time that he said I cannot defend
He
the state
recused.
on.
Oo.
Yes,
He
yes.
recused.
So sana ang ginawa na lang, pero mong two weeks yan na buong bürokrasya naka-frozen delight. Hindi maintindihan kung gagalaw ba tayo, itutuloy ba natin ang programa natin, yung procurement ba natin, itutuloy natin, sinong pipirma. Ang daming naantala. Kaya nagtataka ako nung sinabi niya na yung EDSA rehab, wag mo nang ituloy kasi hindi maayos yung cost-benefit analysis.
Malu,
Ah.
that's what I wanted to talk to you about, no. So after nung midterm election, so nagulat tayo sa mga resulta, tapos biglang itong revamp na parang hindi naman, and then yung EDSA rehab na hindi naman. So a lot of people are saying this is sending a lot of signals, no? Sign daw of weakness of the administration. Are you saying the same thing? Meron ba kaming hindi nakikita dito?
Parang
Hindi,
urong-sulong, wishy-washy, hindi alam kung anong gagawin.
Kitang-kita nyo, hindi nga hindsight ito eh. Kasi ang hindsight 2020, ito talagang kitang-kita natin na bago pa mangyari yung revamp, nakikita na natin na uurong ito. 'Di ba? From the, anong una niyang ginawa? It was the podcast. The podcast, the reconciliation thing. And then suddenly turned 180 degrees. And then after that podcast where he acknowledged his fault and alam ko hindi nyo nararamdaman, 'di ba, ang gobyerno ko. So after that, then came the 2-week hindi daw purging, sabi ni ES, but you know, when you have the same economic team who practically did the GAA and then the PhilHealth, di ba? Parang, hello? And then you have the national security cluster that actually played a very important role in the ICC, in the rendition of the former president. And then everyone was saying, oh, baka naman yung agriculture kasi matagal nang pinangako yung 20 pesos na rice. Pero they proved that it can be done, pero hindi naman nila roll out nationwide. So I don't know what happened to that. And then you have that PR stunt on a Sunday when the whole family was there to take a ride on the MRT3, which actually opened a lot of problems because they didn't know how to buy the ticket, how to insert the ticket, di ba? So parang nagkaroon pa ng problema yung ginawang stunt na yon. Medyo, yeah.
Malu, nabanggit mo na rin before ko makalimutan, no, Secretary Anyo, medyo vague yung sagot ni ES Bersamin doon. May alam ka ba? Anong basa mo doon?
I mean, he did say there will still be more blood.
But he said hindi dumaan sa kanya yung courtesy resignation. Does that mean dumiretso kay Presidente? Because there's still no verdict on that.
Alam mo, yun ang problema eh. Who is the team who is going through the process of evaluating all these secretaries? If there is a team, siguro naman kailangan sabihin, kasi hindi alam ni ES. So I, for one, I was expecting that ES will be relieved, si SAP will be relieved because he was involved in so many issues during the campaign. There was talk that the PMS secretary will be removed. And definitely the whole communication team. Yun yung aking bet. Pero sabi ko, ano ba yan? Parang mali.
But we don't see Attorney Claire that often lately.
Well, rightfully, kasi, you know, when you insert someone during the campaign and the role is just to blame Duterte, I don't know if she had the role in the nosedive of the president in terms of trust.
All right, so let's move to the next. Kasi what you're saying is this attempt to re-energize the government was a dud.
Yeah,
move on to the next.
That's right, Ces.
Yung
The impeachment.
Oh, yung impeachment,
Why
inyo ko
does,
sinabi, Ces.
why
Di ba,
does-
Ces, remember?
Ano yun?
During the campaign, when I was there, I told you na the impeachment is on dead water.
So,
diba?
But why would the Senate President say that too? Na it may
alam
not
mo,
happen at all. Is
Yes.
that correct for him
Yes. It is
say
correct.
that? Why?
Yes, it is correct.
Why?
You covered the Senate, and you know the Senate is by tradition. They follow their rules, and the rules say that they have only 2 weeks upon resumption. And those are not calendar days. Those are session days, which means Monday to Wednesday. So itong 2 weeks na balik nila, that's a total of 6 session days. That will end on June 13. June 11, in fact, is not a session day. Diba? So, pero in-extend nila, but they cannot extend beyond June 30. Kasi ang 19 Congress...
But they could have done it earlier. But anyway, wag na natin
Yes.
balikan yung nakaraan. Pero may para... Okay.
Yes.
The other angle kasi doon, Maluno, is sinasabi nila, yun yung sinasabi ni SP Cheese ngayon to hold on to power. May point pa ba to hold on to power? Matatapos na nga yung 19th Congress.
Wala naman. Alam mo yung mga interpretasyon ng mga narinig natin yung sa report nyo na sa House of Reps. Yun puros propaganda. Ang simpleng rason, walang oras. Kailan ba nila forward sa Senate yung impeachment? Di ba wala ng session? So yun yung problemang una, wala nang session. February 4 nagpirmahan ng kung ano-ano, refer nila sa Senado, hindi makaka-act ang any legislative body kung hindi dadaan sa plenary. So wala nang plenaryo, paano, sige, na-receive ng Secretariat ng Senado, i-refer yon sa order of business, plenary yon. Babasahin, tapos sasabihin, referred to the Committee on Rules. Walang maging gawang ganon kasi walang plenaryo. So, during the recess, pinipilit nila, hindi, i-convene mo. Di ba, at most ang ginawa nila, nagpatahi ng robe, review yung mga rules. So, ang mangyayari sa June 11, they will convene as a court, they will adopt the rules, and then they will present itong complaint, and the House of Representatives through the prosecution panel will be able to read into the records ano yung mga charges. Tapos sinabi naman ni Senate President, the most that we can do is we will give the defense 10 days to reply because that's the rules. Again, steep in tradition, susunod sa rules. So kung gusto nilang ibahin yung rules, hindi ibahin, isuspend ang rules, plenary rin yun. May magmo-motion that, Mr. President, we seek the, suspension of the rules so that we can expedite. Lahat yan plenaryo. So,
walang tawid-tawid, Malu? Walang tawid-tawid? Hindi ka naniniwala dun sa tawid-tawid?
Hindi ako naniniwala dyan sa tawid.
Anyway, dadating naman daw yan sa Supreme Court.
Dadating, dadating, pero para maitawid ng 19th at sasaluhin ng 20th, that's a big question. Kasi release na kahapon, maganda yung debate
I thought Sara wanted, what is it?
A bloodbath.
Siya ang sabi niya.
She does. And I want that too, para klarado. Pero paano mo pipilitin ang Vice President na, hoy, ituloy nyo yan. Itong mga ito, meron silang rules at merong President. Di ba? Maganda nga yung pinag-usapan ni Senator Pimentel at Senator Tolentino Kasi may punto doon si Senator Tolentino na iba ang US sa Pilipinas. Hindi mo maihahambing yun.
May punto rin si Coco Pimentel.
May punto rin. Pareho
Okay.
Kaya nga maganda nagkaroon ng ganon. At sa tingin ko sa June 11, and you know this very well, Ces, sa June 11, mahabang talaktakan niyang mangyayari bago pa maipresent yung charges.
Pwede namang pahabain ng araw, stop the clock. Diba?
Pwede yan. But the stop the clock has to be approved by the plenary. And there is a rule that you cannot convene an exiting Congress 30 days before the start of the new Congress. So wala na talagang time.
Well, we'll see. Thank you so much. Tayo ay wala na ring time.
Yeah.
Okay. Maraming salamat sa inyong tatlo.
That was political strategist Malu Tequia.
Okay, time to pause for another quick break. But when we return, NAIA's new operator is promising big changes, such as facial recognition features never before seen in the country's main gateway. The details when we return. Keep it here.
The big story is back with news of outgoing Cebu Governor Gwen Garcia filing an electoral protest against a woman who pulled a stunning upset on her. Garcia has emerged from seclusion nearly a month after the elections to announce that she is contesting the win of Governor-elect Pamela Baricuatro. Garcia claimed her camp has technical and software evidence to prove that votes in over 4,100 precincts were transferred to Baricuatro, the scion of Cebu's or one of Cebu's most powerful dynasties, has not conceded defeat to Baricuatro, who garnered 1.1 million votes in the May 12 polls. Baricuatro said her victory is a testament that Cebu remains, quote, unquote, a Duterte country.
Meanwhile, NAIA's new operator vows to improve facilities of the country's main gateway as President Marcos eyes expanding the airport to accommodate more tourists. New NAIA Infra Corporation President Ramon Ang says he plans to install facial recognition devices in check-in and immigration counters for easier ticket processing and shorter waiting times. The installation will take 6 months and will not incur additional costs to passengers, according to Ang. His statement comes as Marcos strolled through check-in counters and the newly opened Immigration and OFW Lounge at NAIA Terminal 3. For now, Marcos is satisfied with the changes implemented by new NAIA Infracorp since it took over operations of the airport in September 2024.
And time for our big picture tonight, which is the University of San Carlos College of Law moot team outperforming champion teams worldwide at the Philip C. Jessup International Law Moot Court Competition in Washington, D.C. The USC team bested renowned institutions such as Harvard in the Best Team Memorials category. The team is composed of Mel Joseph Castro, Yoveli Delubio, and Bri Unabia. The Jessup Cup, which held its 2025 edition in April, is the world's most prestigious international moot court competition. Congratulations to our law students. Forever silang nananalo.
Maybe a good topic for them would be the impeachment, if it can cross over or not.
Oo nga
Should the Senate...
Pwede natin i-guess, nandun pa ba sila abroad?
Oo nga, papahanap natin. Kasi I think last year we have the UP team, alma mater ni Pauline.
Yes.
And they came here to the set. So maybe possible. Okay, nandiyan na yung mga susunod sa atin. So that's it for the relax. May ginagawa. Nagtatali pa yata ng korbata.
Alam mo, magaling tayo sa pananalita, no? Ewan ko, we always win this thing.
Yeah. So proud of something to be proud of today.
It is naman, but I don't know. Words
are important.
Messaging.
Communication, and arguments. That's it for the big story on this Tuesday evening.
We are One News, all sides, all the time.
Thank you for watching. Have a good night.